This video will give you an overview of how to format a PICO question. Every time we see a new patient, we need information about some element of their diagnosis, prognosis, or management. Because our time to find this information is often limited, we need to be very efficient with our searches. To achieve this efficiency, we need to become skilled at formulating clinical questions. One method for achieving this is called the PICO method, where P stands for patient, I stands for intervention, C stands for comparison, and O stands for outcome. This chart provides additional information on the elements of the PICO question. P stands for patient or problem, where we will have a description of the patient or the target disorder of interest. I stands for intervention and could include any of these. C stands for comparison intervention. This is most often relevant when you're considering a therapy question. And finally, O stands for outcome, the clinical outcome that is of interest to you and to your patient. I'll show you how it works. This is our scenario. A 28-year-old woman who suffers from depression has just learned that she is pregnant. She has been taking an SSRI for several years, but now wonders about switching to something alternative, such as St. John's wort. Let's think about our patient and what questions might arise from this scenario. One might be, is St. John's wort effective as a treatment for depression? Another question might be, is St. John's wort safe during pregnancy? Let's format that second question into a PICO question. So beginning with patient, we have a 28-year-old woman who has depression and who has just learned that she is pregnant. Our intervention is going to be St. John's wort. Our comparison will be SSRI. And finally, the outcome. What we would like to see is a safe decrease in the symptoms of depression. Finally, our PICO question might look something like this. Does St. John's wort safely decrease the symptoms of depression in pregnant women?